So you take care of a lot of wear and tear, arthritis. You still do a lot of trauma as well, especially when it comes to when you have a new referral. Let's talk hip and knee especially, and people have come into you, potentially surgical candidates, but haven't had a lot of care. What kind of injections do you offer them? Are you able to do that?
Sure. We do a lot of injections in the clinic, not because we like sticking people with a needle, but because there's a lot of utility to it. I think whenever folks listen to advertisements on the radio and you read on the internet, there's a lot of really bad information out of there. And by bad, I don't even mean that they're not telling you the right thing. I think it's very misleading. And I think that it creates a lot of confusion. If you hear it from friends, you hear it from relatives, and that can be dangerous. There's three categories of injections that we tend to use. And the one that I use most frequently, because a lot of times I'm seeing patients with something that's post-traumatic, that's more severe, or somebody that we're trying to differentiate from surgery. The one I'm going to focus on initially is the steroid shot. Steroid shot has two components. It's got a numbing agent, and then it's got the actual steroid. The numbing agent's going to numb the joint itself, give you some immediate relief, and that's diagnostic for me. If I do an injection in a joint, it feels a whole lot better right away. At least I know we're in the right area. We're treating the right thing. Second part of that's going to be the steroid, and that's whenever you're starting to get some anti-inflammatory benefit. That lasts a lot longer, brings down the inflammation, helps reduce the pain, not because it's numbing it, but that's actually helping improve the joint itself, so that way you can get that longer term relief. But there's downsides. Steroid itself, used too frequently, it raises your blood sugar. It can start to damage the cartilage, we know in animal models at least. So we're hesitant to use that as a long-term solution, but it's nice acutely. But from y'all's standpoint, y'all do a lot more than I do. Biologics and the visco supplement type injections. Talk more about those.
The visco supplement injections have been around now for years. I've been in practice 21 years, so they've been around my entire career at least. Visco supplements work well with arthritis. Typically it's arthritis of the knee. Everywhere else, not covered by insurance is one, but I think a big reason it's not covered by insurance is because it's very 50-50. The knee, it seems to work very, very well. Again, covered by insurance. Which is a good thing for all of us who are paying our premiums.
Right.
Absolutely. And it has a high success rate. Even people that are very, very severe tend to do well. These injections are typically from rooster comb or rooster crest. So a lot of people will come in and ask for or say, hey, tell me about your chicken injection. Tell me about your rooster injection, your rooster shot. There's a couple of synthetics on the market, but you will hear the terms rooster comb, liquid gel, liquid cartilage use, and we do a significant number of those. Those help. For us, we use those. They help. They eventually stop working. That is when we would get somebody like you involved.
Yeah,
is it time for a replacement and so forth? But there are some patients that injected them every year and a half. I've been injecting for 15 years, and they've done real well.
And the only thing I always caution about those folks is don't get sucked into a cycle where you feel like it's not working, but you're still doing a shot.
Correct.
That is one thing that kills me, is folks will be like, well, they said it didn't. I told them, well, doc, I only got a week or two of relief out of this. These things need to get at least 6 months of good quality of relief, or it's not worth doing. It's not magic. This isn't a time machine.
We always try to consult our patients that we will probably hit a point where they don't work as well, they stop working. At that point, we've got to talk about alternatives.
Yeah.
We're not going to push you into any surgery or anything, but we're going to be very honest about we're moving on probably to this instead of living with the pain.
But then now we have biologics, PRP, amniotics. Talk a little bit about what you've seen with those and when you use them.
Yeah, so biologics for us include PRP and cell injections, specifically cells derived from amnion. The proper term's amnion cell, but I think the media has run away with the term stem cell. Although what we found is we can't prove is there stem cell in it. Is it
so
really
much
effective?
Variation. Yeah.
Right. PRP is platelet-rich plasma. I get asked all the time, whose plasma are you using?
Yeah.
We're using yours. In fact, just very quickly, whenever anybody comes in for a PRP injection, we draw your blood. You do not have to be fasting. In fact, quite the opposite. We want you to be well hydrated. No anti-inflammatories for about 3 days. We draw your blood, spin it for about 10 to 15 minutes, and we keep the plasma. We throw away the red blood cells and the white blood cells. We don't think they're quite as effective. And we inject it right back into the knee during the same visit. We are not doctoring up the plasma to make all the proteins and growth factors that that help you with inflammation or anything like that. We think that these injections, PRP, are great anti-inflammatories. People definitely feel that within as many as 3 injections, but typically 1 to 2, they feel a lot better, and they tend to last for a long time.
Right.
Amnion cell injections working quite the same way. If your own PRP has good stuff to help you feel better and aid in function, we think amnion cell has a lot more of the good stuff.
Right.
And it's basically several proteins that are mostly growth factors, things that help fight inflammation, that help. Can't promise that it regrows anything, but what we know is that people feel better and more functional for a long time.
Yeah.
The only downside is that these are not covered by insurance, still being studied by the FDA, but because they are not considered a new medicine, we are not doctoring them up. We are allowed to do them. They're under a cash pay product. They're under a cash pay price list, and that's something that any of us can talk to you about if you're interested. I make it part of my discussion to let patients choose, along with rehab and medications and can supplements help me and so forth. When they have arthritis, literally of any joint, I make it part of the discussion and try to bring up all the pros and cons.
Well, and please don't fall for the marketing on these things. That's what kills me. It's like we watch these videos and we see them too, in between two, TV segments or sports segments, all of a sudden something shows up and they show this x-ray and then they got an injection and magically it looks like they're 20 years old again. It's because they put a 20-year-old's knee on the x-ray. I'm sorry, that's not the same patient. It just doesn't happen. But these are really nice products, and the literature right now goes back and forth about whether or not they work or don't work. And that's where I think the whole art of being a physician comes into play. We've done thousands, you've done far more than I have, thousands and thousands and thousands of these, and we talk to our patients after, and I promise they wouldn't come back if these things didn't work. But part of it is how we use it. Again, we don't use this as a silver bullet magically fixing everybody, but it's worth trying in most patients. We have a lot of success with all these different products. I see better results with the biologics, but again, they're not covered by the insurance. So if the hyaluronic acid product, the Visco product, is going to be the one that's covered, we'd still rather you use your insurance, but know that these cash pay products are available. And the nice part is we can do them at the same time we see you. We don't have to get approval. That's less time that you're taking off at work, less jumping through the hoops. And with insurance premiums being higher and higher every year, sometimes it actually ends up being a cheaper option. But it's not something that we're just going to keep throwing at you, even if it's not working. It's not.
Yeah, one thing I promise everybody in any injury we treat or any pain we treat is we're going to go over the options for you, not necessarily what worked for your neighbor or your friend, but what is unique to you. And I'll always give you options with the pros and cons, and then we decide from there.
For sure.